guide, study guide as to what you really needed to know from chapter 13. I will put that quiz out there starting tonight. I'll give you the weekend to cover chapter 13. We will not finish chapter 14. If you look at it, it's pretty long. It's a long chapter. It is impossible to get through all that today, which means your test will be November the 6th, because originally I had the test on November the 1st. That was next Thursday. It's going to take us 2 class periods to cover chapter 14, which will put our test on November the 6th. For many of you, you should be smiling because you have a practical next week in microlab. So now you can focus on the microlab for next week, and after that you can focus on this test the following week. Where's the mom? So, are there any questions about the review sheet I put out there for chapter 13 in terms of what you really had to know from Dr. K's lecture? You have his PowerPoints. I gave you what you really have to know. Lots of the tables of chapter 13 will help you out in terms of simplicity or any basic questions about chapter 13, viruses. It's pretty cool. I wish I could have taught that one. Viruses are cool. But this is even cooler. Because in this chapter, we learn all about host-microbe interaction. In other words, this is all about healthcare microbiology. We have to understand how can microbes actually make you sick, right? How do they get into your body? How do they take your residence? And how do they really make you sick? All right, so let's get into that. Oh, the first slide. Now, we've heard about symbiosis before, right? Symbiosis literally means what? Living together. Now, the symbiotic relationships, they can be a bad relationship or a good one. It just means you've got 2 organisms living together. Now, we've got 3 types of symbiotic relationships, okay, based on who benefits and who suffers, okay? We've got mutualism, commensalism, and parasitism. Now, real quick, I'll go through all of them in detail, but real quick. And mutualism, right, this is a mutualistic relationship, right, which means both parties benefit, okay? Now, in commensalism, one party benefits, the other party is not harmed. In other words, the other party, there's nothing they're gaining from their relationship, but they're not harmed in that process. In parasitism, okay, that's where one party benefits, but the other one is harmed in the process. That's the bad one. That's the one we care about in healthcare microbiology. That's what we care about. Let's go through that really quick. Okay, so table 14.1 summarizes all 3 of those symbiotic relationships, okay? So in mutualism, again, these are all symbioses, right? Symbiotic relationships. You've got 2 organisms living together, all right? So in mutualism, both organisms benefit, okay? Your example, I told you all, the first day of class, you have more bacteria in you and on you. They're supposed to be there. For example, there's lots and lots of bacteria in your gut. They're called enterics or coliforms, right? What are they doing there, okay? Well, they like it there because that's where all your food goes through, right? Whatever you eat goes through your intestines before you get rid of it. Well, those bacteria are eating whatever you ate. If you had pizza, they're eating pizza, right? You had a hot dog, they're eating that hot dog. So that's their benefit, right? You got a nice, warm home, free food. But what do you get out of that? So many of those bacteria, including E. coli, right, your favorite gut organism, it's producing vitamins. Vitamin K. You can't buy vitamin K in the store. You can find A, B, C, D, E, but you can't find K, right? That one's missing on the shelf, okay? Because E. coli makes it for you in your gut. So when you are born, okay, guess what? We'll get into this in a minute, but when you're born, do you have E. coli in your gut? When you're born? No, you don't. Your gut is sterile when you're born. It's sterile until you start eating food, right? It's sterile. Now, usually when you're born, the first thing you get, within the first day, you get a shot of vitamin K. Make sense? You get a shot of vitamin K. Because when you're born, you don't have E. coli yet, which means you don't have a source of what? Vitamin K. You can't buy it in the store, but you do get a shot of it. That gets you going. Because as soon as you start eating, makes sense, as an infant, as soon as you start taking in food, you get the E. coli. E. coli takes up root in there, and therefore E. coli takes over the job of what? Producing vitamin K. Now, how about commensalism? Again, one of the parties benefits, the other one is not harmed, but doesn't have anything coming out of it, okay? So let's take a look at this. Staphylococcus on the skin, like staph epidermis, right? Epidermis means what? Epidermis is on your skin. Now, let me ask you this. Who is clearly benefiting? Is it the staph epi, or is it, clearly benefiting? Think about it. Who is clearly benefiting you?
Us.
You. Both. Both are good.
Who says the person? Who says staff? Okay, you're right. What do you think Staph Epi is doing on your skin? He just likes it on your skin? What do you think it's doing there?
It's your normal flora.
Or nutrients. It's eating things off your skin, right? It's eating secretions from your skin. It's eating dead skin cells coming off your skin, right? It's eating it. It's food. Why else would it be there, right? Why else would it be there? It's eating nutrients from your skin. Now, there's not a direct benefit. In other words, we can't prove it. Sure, we say, yeah, if Staph Epi is on the skin, then in theory, right? In theory, it's taking up space that some pathogen can take up. But there's no concrete evidence of this. You know why? Because guess what? You need to test this out. Does this make sense? You would need to take Staph Epi off of your skin, right, to see if you develop skin infections. It's darn near impossible to get Staph Epi off your skin. It's on you. It's in the hair follicle. Make sense? So we really can't prove that per se. Yes, it's a theory and it sounds good, right? We want to think that. Now, yeah, we know that's true about the colon, right? We know that. But I'm talking about on the skin. Makes sense?
Is that what eats the sebum?
Yeah, it can eat the oil in your hair follicle, or all of this is dead cells anyway, right? It's just eating all the dead cells. It's eating nutrients. Okay, so far so good, right? Now, what about the last part? Parasitism, and this one, only one of the parties is actually benefiting, but the other one is clearly harm. This is your host-pathogen relationship, okay? So any type of infectious disease where you have some pathogen coming into you, okay, they are basically eating nutrients, whether on you or in you, right? They're taking nutrients from you. And in the process, they do some damage. It could be tissue damage, right? They can release toxins out that can make you feel bad, so they harm you. They can take you out, correct? That's a bad relationship. That's parasitism. Now let's talk about this normal microbiota or normal flora. It all makes the same difference, okay? All of these words, I say both. I don't use indigenous microbiota. That one's funny to say. I usually use normal microbiota or normal flora, okay? These are the organisms that are naturally found on your skin or in you. In fact, they outnumber your cells by 10 times over. And I told you at the first day we met, right? They're on you and in you. Now, they colonize your body, but they don't normally cause disease, okay? If they are found where they're supposed to be found, right? Staph Epi is on your skin. So is Staph aureus on your skin. As long as Staph aureus is on your skin, it's not going to cause you any harm. E. coli is where? In your gut, right? It's supposed to be there. It's a part of the microbiota in the gut. But guess what? If E. coli is found somewhere else, do you think you'll get infected? You sure can, right? So normal flora, they don't cause infection as long as they're where they're supposed to be. Makes sense? If they go somewhere else, then they'll cause some damages. Now we've got two types of normal flora. We've got resident microbiota, and we've got transient microbiota. All right, let's talk about that. Now here we're showing you an SCM, like three-dimensional normal flora in the nasal cavity. So there's lots of bacteria in there, right? And they're supposed to be there. They're hanging out. That's just fine. So some of you, about 20% of people, actually have Neisseria meningitis within their nasal cavity. And they don't get sick. It's a part of their normal flora, okay? Now let's say if you don't have Neisseria meningitis, which causes meningitis, by the way, right? Bacterial meningitis. If you're not one of those 20%, right, that normally have it in your nose, and if you happen to get it in your nasal cavity, right, guess what? You probably end up with meningitis, makes sense. But some people just naturally have it. It's a part of their what? Normal flora. They're used to it. All right. Now let's talk about the resident microbiota. Okie dokie. They are a part of you for life. Like I said, you can't get Staph Epi off of your skin. It's stuck with you, okay? Now, most of these guys are commensal, meaning they benefit, right? They benefit, but they don't really give you any added benefit. I already suggested about E. coli in your gut. That's mutualistic, for example, right? If E. coli is making vitamin K for you, E. coli gets food from you, it's a one-on-one, that's good. But if they're on your skin, for example, they're just eating nutrients. They're not really doing you any good. Now, where do they come from? Okay, think about it. Where does your resident microbiota, the guys that are with you forever, where did they come from? Think about it. The environment. Okay, the environment. Now, if you start off in the womb, is that a sterile environment in the uterus? Yes, it is. It's supposed to be, right? You don't want bacteria in there when you're developing. It's sterile. So as soon as you come out the birth canal, that's when you're first exposed to bacteria, right? That's when you first develop your microbiota. As soon as you're born, as soon as you go through the birth canal, you're getting bacteria on your skin, right? As soon as you're held by the nurse, right? The nurse step epi on her hand gets onto your skin, makes sense? As soon as your mom or dad holds you for the first time, whatever's on their skin gets on your skin, makes sense? When you take your first meal, right, whether from a bottle or a nipple, guess what? You get bacteria into your body, makes sense? I'm just being real, right? I'm just being real. So you start off sterile, right? But as soon as you come out, that's when you get that microbiota. And I'll tell you what, the microbiota you have right now, you got it within the first month of life, basically. So whatever you have right now, in your mouth, in your gut, on your skin, you acquired it within the first month of life. After that, they're there forever. Got it? Now this chart here, 14.2, I didn't really finish it, but 14.2 just goes through the different parts of your body which normally has bacteria or yeast or maybe even protozoans living there. Okay? Now do you see every single part of the body or every type of organ on this chart? Because not everything needs to have normal flora, right? Some things need to be sterile, makes sense? Like your brain, for example, or liver, or your blood, makes sense? You don't see everything on this chart. You just see places on your body that can be colonized by bacteria. Now, I do want you to know some examples of bacteria and where they're normally found, okay? I'll just mention a few of them. Let's see, real quick. I'm going to point out lactobacillus. Why? Because you find lactobacillus in dog near every doggone column, okay? You can find it, okay, in the upper respiratory tract as well as in the vagina. I mean, it's everywhere, in your mouth, head to toe. I will point that guy out there, okay? It's a facultative anaerobe. He's found everywhere. Nose, mouth, vagina, gut, okay? He's everywhere. I've already pointed out to you, right, this is the lower digestive tract. I mentioned already with E. coli. That's my favorite one, right? He is my favorite bacteria, so you should know it too, right? So E. coli is naturally found in your gut. And as long as he's there, he won't cause any problems for you. So know E. coli, know where he's found. Anybody else I like on this picture? You should know, for example, on your skin, they don't have skin, but yeah, they have skin. On your skin, I talked about staphylococcus, really staphylococcus, what, epidermis, right? It's all in the name right there. They have here Propionibacterium, okay, way down there. The Propionibacterium, his last name is acnes, just like acne with the S on the end, okay? That guy can cause acne. He lives, just like the other guys, within the hair follicle, but Propionibacterium eats the sebum. In the process, it can cause an infection. It can irritate your skin, basically, and you basically get a pimple. So a pimple is basically an infection. That's what it is. It's an infection of bacteria in there causing havoc. It's Propionibacterium acnes. You should know he's on your skin. Anybody else I like on here? No, I'll just hold you to those three. That's enough to know. Okay, but just note that what you don't see, right? I meant you don't see blood, you don't see brain, you don't see organs, right? So just note what you do see, where you can find these microorganisms. Now, quickly, let's talk about these transient microbiota. They're transient because they don't take up permanent residence in you or on you. Basically, you come in contact with these transient microbiota by contamination, makes sense? You use the bathroom, right? Didn't wash your hands. Great, you got E. coli on your hands, makes sense? Yeah. Or you're preparing chicken, right? You got salmonella on your hands. So basically, these are basically contaminants on your skin. They remain in you or on you for a very short time because they're not normally found in that region. So in other words, E. coli is normally found in the gut, right? It's perfectly tailored to the gut. E. coli is not normally found on the outside, makes sense? Is that clear? Right? So these transient guys, they don't remain for a long time because they're not used to that environment, basically your body. Now, they can be found in the same regions as resident microbiota, but they can persist. These are the reasons why they don't hang out for a very long time. Now, for example, if you just wash your hands, you remove them all together, right? I said it's impossible to remove normal flora. They are permanently with you, but the transient ones, right, you can just wash your hands and they're gone. So that's one reason why they don't stay with you. Okay? Well, let's say they bypass the hand washing business. Well, they got to compete with the guys who are already there, makes sense? There are already bacteria in your gut. If you eat something that was contaminated and gets into your gut, it has to compete with all the other guys. Let me go back. Where is it? Do you see all the bacteria? And this is not even all of them that are in that gut. You got to compete with all these guys if you want to take up root, makes sense? That's a lot to fight for food. Right? Your body, your immune system, right, does a good job removing those transient organisms. Now think about it. You have to think in here, correct? Your immune system will actively take away organisms that aren't there, right? Transient ones. But why not the normal flora? Why not get rid of E. coli in your gut? Or Bacteroides? Or Lactobacillus, which is basically everywhere in you? Why not take away those guys? Think about it. Think about it. Okay, so your immune system recognizes it. Why? What's that? They have markers. Well, when did I say you acquire your microbiota? When did I say you acquire it? Within a month of being born. Whatever you obtain within a month, that's what you have for life.
Antibodies.
Now, guess what? You don't have a functional immune system when you're born. You really don't. You're dependent on whatever your mother can pass on to you, right? I mean, you don't really have a functional immune system. So you basically develop your immune system at the same time as you're exposed to these microbiota, right? So they basically recognize as self, right? If you already have them on your body, at the same time you're forming your immune system, correct? They will be recognized as a part of you, makes sense? That's why your body normally doesn't attack itself, makes sense? It's a part of you, and at this point, if you're 1 month old, you don't have an immune system yet, you already have microbiota, but when you develop your immune system, whatever's on you already, it's considered a part of you. So that's why you don't get rid of E. coli. That's why you don't get a lactobacillus, right? It's part of your body, basically. Also, chemical or physical changes in the body. So sometimes, for example, the conditions have to be just right in order to maintain a transient bacterium. So I'll talk about the vagina, for example. I know it's a lovely topic. Okay, the vagina has to be certain pHs in order to maintain certain types of bacteria. So you can be exposed to a certain type of bacterium, for example, in the vagina. But if the pH isn't right, it's not going to persist for a very long time, okay? Now, I already kind of gave you a preview of this one, but we'll go through this really quickly. In other words, this is talking about how do you acquire, what? The normal flora. Where does it come from? I just talked about if you're starting off in the womb, that's a sterile environment. It's supposed to be sterile. So this word here, azenic, just means sterile. It's free of microorganisms. So where do the microbiota come from? I just explained to you the actual birthing process. As soon as you go through that birth canal, you are exposed to lactobacillus, right? It's hanging out all in there. Even if you're born by a C-section, as soon as you come out, right, you're exposed to bacteria in the air. You're exposed to bacteria from the nurses, the doctors, whoever else handles you during that time. So as soon as you come out, you're exposed to microorganisms. As I just mentioned, all of your normal flora, and it can vary depending on who you are, makes sense? It can vary. You get it within the first month of life. After that, it's with you forever. You don't really acquire new normal flora, makes sense? At this age, you don't. There's no room for that. Let's see. Now, sometimes the normal flora can go rogue. In other words, I said that if it's found, it being the normal flora, if it is found where it is supposed to be, it won't cause havoc for you. However, if part of the normal flora goes somewhere else in the body, it can cause infection. We call this opportunistic infections, or basically opportunistic pathogens. So basically, opportunistic means what? They had an opportunity, right, to make you sick. So these are basically normal microbiota, right, that can cause disease under certain circumstances. So what are these circumstances, for example? Okay, I just mentioned this one, right? They got introduced somewhere else. So If you have poor bathroom habits, you don't know how to wipe yourself, okay? E. coli can get up in the urethra, okay? I'm being serious. That's how you get UTIs if you know how to wipe yourself appropriately, right? Front to back. Front to back, okay? E. coli in the gut, fine. E. coli in the urethra, UTI, makes sense? I know Rhea is laughing. It's a serious thing, okay? It is the truth, okay? Immune suppression, okay? Oh boy, this can be a number of categories, like the very old or the very young, right? I just said when you're young, you don't have a functional immune system, right? Very old, their immune system is just old, okay? How about in HIV patients, their immune system is already compromised? What about cancer patients? If they're undergoing cancer treatment, right, their immune system is what? Compromised. If you're sick, for example, you stress out over this test, right, immune system is what? Compromised. Lack of sleep, compromised immune system. All of those, somebody knows about that, all of those can make you more susceptible, right, to an infection by these normal flora. Changes in the normal microbiota. What does this really mean? All right. Let's go back to the vagina. This is a clear example. You're like, why talk about bees all the time? This is a perfect example, right? It's not just I'm a woman. It's clear. In other words, most ladies know. And they don't want to admit this, okay? Most ladies know they get yeast infections from time to time, okay? Hit it.
Why can we talk about that STDs for once? I mean,
We don't
always talking about
get
vagina.
UTIs like you do.
That is true. That's a true statement. Guys do not get UTIs as frequently as women. Okay? One main reason, okay, is just the proximity of the urethra from the anus, okay? Two, the urethra in men is longer than the urethra in women. So in other words, if you're E. coli, you got to make your way up to the bladder before you get peed out. Okay? Now, in guys, that's a long ways to go.
Depends on the guy.
Okay? And women, the urethra is kind of short. So E. coli doesn't have to travel that far to make it to the bladder. It's as simple as that. So basically, take home message, pee frequently. Right? I'm serious. Urinate frequently because you want to wash away any bacteria that got introduced in there in the first place. Make sense? I'm just trying to be real practical with you. I'm just trying to keep it real here. When you engage in certain activities, pee before and pee after. Okay? You understand why? I'm not even trying to put those words in there. You all adults, you know what I'm saying? Urinate before, urinate after. Why? Wash the bacteria away that got introduced into that area. I guarantee you that will cut down UTIs dramatically by just doing that. Simple as that. Just pee. Just pee, okay? Now back to this, okay? Back to my yeast infections, okay? Okay. Yeast infections are caused by Candida albicans. It's a yeast, okay? It's a part of the microbiota in the vagina, but it's also an opportunistic pathogen, okay? Now usually, if the pH is kept right, you'll have lots of bacteria in the vagina, which will keep the numbers of the yeast low. So the yeast are already there. They're present. But if the pH is just right, the numbers of bacteria will be high, makes sense? And then the bacteria count is high, that's less room for what? The yeast. Now, sometimes, some parts of the menstrual cycle, or if you're pregnant, the pH of the vagina will change. And if that happens, the bacteria don't like it as much, or not growing as much, that gives the yeast time to grow and really overgrow. So basically, a yeast infection is an overgrowth of Candida albicans. It's not that it got introduced there, it's already there, makes sense? It's a part of the normal flora, but it can really overgrow when the bacteria down, when the pH is wrong, makes sense? So that's what I mean by changes in the normal microbiota. As long as the bacteria are there, yeast can't grow, makes sense? And the bacteria are gone, especially when you take antibiotics, for example, when the bacteria are wiped out, that's when the yeast can outgrow and cause havoc. Let's see. Now, most pathogens, they don't last outside the host or the body for a long time. Think about it. If they're pathogens, they're used to being inside of a host, makes sense? That's their niche, got it? Which means if they're found outside of a warm body, they don't make it very long. All right. Now let's talk about this word, a reservoir, or reservoir of infection. Now, a reservoir is basically where the pathogen is maintained. So where is the pathogen maintained in between hosts, for example? That's a reservoir of infection. That's your source of infection. Where is it hiding out? Where is it contained before you acquire it? So far, so good. Where is it? Now, I've given you 3 examples of reservoirs, and I believe on your test review I sent out this morning, they're on there. Okay, we'll talk about animal reservoirs, human carriers, and non-living reservoirs. Again, these are just hot spots, right? Or pathogens. Where are they hiding out before you acquire them? Okay. Let's talk about animal reservoirs, okay? Now, diseases that are passed from animals to humans, these are called zoonoses. Now, Z-O-O, right, means zoo, literally. It means zoo. Zoo means animal, okay? So, zoonosis, these are diseases that are just spread from animal to human. It's a natural process. Now, how do you acquire these zoonoses from animals? Lots of different routes, right? Like direct contact with the animal or with the animal's waste. Okay? So that's one way you can acquire a zoonose disease. Disease is passed from animal to a person. Or basically eating animals, for example. Let's say your cow has some kind of infection, okay? You eat the undercooked cow, you also get it, okay? Simple as that, just eating the animal. Well, what about blood-sucking arthropods? Now, back in chapter 12, I talked about 2 types of arthropods, make sense? So I talked about ticks and mice and all the other insects, got it? Well, the mosquito happens to bite one animal, correct, that has the pathogen, takes it up. Okay. Then that mosquito bites you, injects that pathogen into you, well, now you've got that disease, got it? All right. Now, not on this list, which should be on the list, is if the animal actually bites you. For example, lots of diseases like rabies is spread, for example, if a rabid raccoon bites you or a rabid dog bites you. That's how you get the virus rabies. So include biting from the animal. Now, humans are usually the dead-end host for a zoonotic disease. In other words, if you get the pathogen from an animal, usually it stops with you. Normally, you don't give it back to the animal. Now, why is that? So why do most of these zoonotic diseases, why do they stop with the human? Why not give it back to the animal? How would you give it back to the animal?
Recognition. They've already had it.
Would you bite the animal?
No.
Would the animal have contact with your feces normally?
No.
No, not usually, right? Let's see what else we have in here. The animals usually don't eat us, right? Usually they don't. But what's one thing on here, what's one method that a zoonotic disease can get back to the animal from the person? What's one thing on there?
Direct contact.
The arthropod, right? So a mosquito can bite you, right? Just like it bit the animal, it can bite you. And now bite the animal to get the animal back that disease, got it? So this is the only way you can go from human back to the animal. All the other methods are really the animal giving it to you. Okay, now, do you have to know this one? Because someone's like, do I have to know that? No. What I'm just trying to show you are just examples of zoonotic diseases. Some of them should be familiar with you, for example. Let's look up, I don't know, anthrax. Now, yes, anthrax, you get anthrax by inhaling those spores or touching the spores. But where does Bacillus anthracis usually hang out? Really, cows. So domestic livestock. We talked about the bubonic plague. That was about 2 chapters ago, right? I talked about Eugenius pestis. Where is it hanging out? In rodents, right? Then the fleas are the vector, right? But Eugenius pestis, okay, the bacteria that causes the plague is in rodents. Makes sense? So many diseases you already know. Anything else, real quick? I talked about rabies, right? Hanging out in either wild animals or in dogs. And where do the dogs get it? From the wild animals, right? Your dog, they give it to you. Yeah, the hantavirus in mice. Okay, found in mice. Okay. Now let's talk about human carriers. Again, this is under reservoirs of diseases. Okay, where are they hanging out? Now, a human carrier, this is a person who is carrying the disease, and they may or may not be having symptoms. In fact, okay, they're infected. And this word infected just means you have pathogen. Okay, you have the pathogen. But in this case, they're asymptomatic, which means they are not showing any signs of that pathogen. They have no signs of sickness. They don't even know they have it. Why? Because usually the only way you know you're sick is when you start feeling sick, right? They have the pathogen and they don't know they're sick. So they're carriers. Now, some individuals, they can eventually develop illness, while others may never, ever get sick. So, I mean, seriously, think about HIV infection. Think about why HIV is so bad in this country, or basically all over the world. Because when you first acquire HIV, right, you're basically asymptomatic for a long time. It takes a long time to wipe out all your helper T cells before you even realize you are sick. And by that time, it's too late, right? It's too late. That's why you keep hearing people over and over again saying, well, get tested early, because you'll be asymptomatic for like 10 whole years, and you will never know you have HIV. Meanwhile, you're giving it to everybody else, okay? And by the time you realize you have HIV, it's too late, because by that time, you have no functional immune system. And you have to understand this. You can take all the drugs in the world, but you have to understand it's your immune system that takes out the pathogens. Now, drugs help you fight that battle, makes sense. But you got to understand, without a functional immune system, no drug in the world can save you. Your immune system has to be able to take out that pathogen, makes sense? Okay? Now, healthy carriers, in other words, some people, this is under people who never get sick, okay? Now, healthy carriers possibly may have some defensive mechanisms that basically help them from getting sick. Now, have you all heard about Typhoid Mary? Mary Malone? Oh, my word. Let me tell you about Typhoid Mary, okay? She was an immigrant from Ireland, came to the U.S. in the early 1900s, and she wanted to be a cook. But Typhoid Mary, she was infected with Salmonella typhi, which causes typhoid fever. Basically, it's like bad diarrhea, throwing up, and you basically die from it. You die if you don't get treated. Now, Typhoid Mary, she has it. In other words, you pass out your body by using the bathroom, either by peeing, urinating, or pooping it out. Okay? Now, Typhoid Mary, she's a cook. She's not washing her hands. Why? This is back in the 1900s. People didn't know about washing hands back then. And she's a cook for people. And she's cooking for people, and people in these households are dying. They either get sick, and some people actually die. And when this would happen, she would basically go to another household. She would go, and this was in New York City. She would go from household to household to household, working as a cook. Meanwhile, making lots of people sick, some people die. Now, of course, the doctors in town, they caught on to her, and they put her in quarantine. They realized, okay, this lady is making everybody sick, okay? She has typhoid fever, even though she never had symptoms. Never had symptoms. She didn't think she had it, would you? I mean, if you don't have any symptoms, you wouldn't think you were sick either, right? Mm-hmm. They put her in quarantine, okay? They keep her from cooking for people. She got out, changed her name. They made her to be a laundress, say you can't cook anymore. You can wash clothes, no more cooking food. Nope, she changed her name, went back to cooking food, made more people sick. Yes, she did. Made more people sick. She got caught again. They put her back in quarantine forever, basically. They had to quarantine her forever. She died in quarantine. Oh. Because if you let her out, she'll go back to cooking and making people sick.
You gotta keep girlfriend out of the
You gotta keep her out of the kitchen, okay? That's Typhoid Mary. Her name is Mary Malone. Why did I mention her? Because she was a healthy carrier, okay? She was carrying typhoid fever. And she was making everybody else sick. And she never developed the disease. Never, ever. Non-living reservoirs. So basically, with the human carriers, think about HIV, right? Think about Typhoid Mary, all right? Think about those things. Okay, non-living reservoirs, okay. Non-living. Soil, water, food can be basically save up reservoirs of basically bacteria for infection. Now, water, for example. Water can hold E. coli or Vibrio cholera, all kinds of diseases hang out in the water. Lots of cysts, right? Like amoebic dysentery, hang out in the water. You drink that infected water, you got the illness. Food, for example, undercooked food can serve as a reservoir. So lots of worm diseases. They have cysts in the muscle of pigs, for example. You eat undercooked pigs, okay, you get worm infections, as simple as that. Now, the presence of these microorganisms, okay, in these non-living reservoirs is often due to contamination, either by feces or urine in the water. Okay. Now, let's talk about about the actual exposure to microbes, we have to define contamination versus infection. These are two different terms. Please understand what they mean. Now, what does contamination mean? Contamination means the microbe is simply on you or in you. That's it. If you're contaminated with E. coli, it's on you or in you somewhere it's not supposed to be. That's it. It's just on you. The presence of the microbe in on your body. That is contamination. That's not enough to make you sick because you can get rid of it or your body gets rid of it. Now, what about infection? Infection is where these organisms that got on you as a result of contamination, they evade your immune system and they take up residence in you or on you. Okay? They basically multiply. They grow. So that's infection. So you've got the microbe in you or on you. Now they start growing. When they're actively establishing roots, right? When they're making a colony in or on you, that's the infection. Now keep in mind, infection does not always lead to disease. This is why I'm trying to spell it out for you. Because you think infection equals disease. No, infection does not always equal disease. Infection just means the organism is actively growing in you. Make sense? I just talked about typhoid Mary, right? She was infected with salmonella. She just never got sick. Make sense? Now, how do these organisms, pathogens now, how do they get into your body? How do they start infection? In other words, how